Alright, we're recording.
Okay.
Alright, I'm here with Bob Carrington, and Bob, why don't you go ahead and just tell us what happened, how you ended up here at Premier Health.
I live across the street for about the last 3 years, and I've been a chronic pain sufferer in my lower back for about 13 years, and one of my neighbors came up to me one day and said, you know, there's a chiropractor right across the street? And I said, yeah, well, you know, I'd been a chiropractor before and hadn't really gotten any relief, and so I wasn't really excited. But I said one day, let me just walk over here and see. And that's when I met you, Dr. B, and since then, my pain level has just been, my situation is so much better. I feel like I'm reclaiming my life again.
Yeah. Now, you mentioned 13 years ago. Why don't you talk a little bit about what happened then? What?
I was an IBM business executive, and I was injured on at work. It was actually an assault, and consequently, I had back surgery on L4 and L5, a fusion, and the back surgery failed. I went to Johns Hopkins and had an opinion, and they said, well, not only did it fail, but there's really nothing that we can do for it. Your life is condemned to what it is. Not only was I depressed as a result of that, I had to totally change my life from a productive worker to somebody that was trying to find a way to be productive.
Yeah. And
that was just a major setback. But I feel since I've been coming to you, Doc, that I'm reclaiming that lost territory. My mobility is coming back. I had just a ridiculous pain in my upper back. It was paralyzing my left side of my body. And since then, that has almost all gone away, and I'm just left to trying to recover now my lower back where my original injury was.
Yeah. Now, you mentioned you were in a lot of pain. What did you do for the pain?
Pills. Don't move.
Yeah.
Avoid cold weather. I mean, there was really nothing that I can do. That was the frustrating thing. It limited me so much physically that I really was unable to really enjoy doing many things that I used to do. And
it had a very strong effect on you psychologically, socially, changed your whole life.
Whole life.
Yeah. So the last 13 years, your life on a scale of 0 to 10, your happiness with your life
was probably 3.
Yeah.
You know?
And now you've been coming here. We've got you through the acute phase where we got you mostly out of pain. We've started your rehabilitation phase. Now, at this point, your life, what would you say on a scale of 0 to 10, your quality of life would be?
I say it's a 6 now. So it's coming back strong, but I've only been coming for about 3 months. And I've recovered so much in 3 months. And the weather's cold now, so the cold weather restricts me. I really can't wait until I've done another 4 or 5 months of therapy and rehab and the weather turns warm.
Yeah.
I haven't walked a mile in probably 13 years.
Yeah, that's what I was going to get at. How long has it been since you've had any relief?
Really, none.
None for 13 years.
You know, I had a great surgeon. You know,
the best.
Very much the best of my.
You're an IBM executive.
Exactly.
They took care of you the best they could.
Surgery is an imprecise science. This is the thing I learned. They think one thing, but when they actually get in there, they see something else. Mistakes can be made. I'm not putting them down. But you know, what
you had a great surgeon,
right?
It's just the likely outcome of a surgery like what you had is poor.
And what they don't tell you is that it might help you for 1 or 2 years, but what about 10 years down the road? That's when it will start to really harass you. But what I've learned now is that you really have to do the therapy. You really have to do the exercise and the therapy. That's the only thing that's going to really bring your back back. It's not going to be going under the knife.
Yeah, it's a combination of things. Yeah. It's really a combination of things, combining the right therapies in the right way, in the right order, at the right time, which makes the difference. And it's a slow, tedious process, but even in the last couple of months, we've made more progress than you did in the last 13 years.
And I know that a lot of people suffer with what I suffer with. That's one thing I've learned. I've been in so many doctor's offices in the last 13 years with this condition. And I've met a lot of people who suffer with what I suffer with. And almost to a person, you know, they wish that they had taken another option before they took the surgical option.
Yeah.
So I would just say, if you are in great back pain or you have a damaged back, truly try to find somebody who has a program of therapy, not just therapy, but a therapy program, which is exercise and therapeutic treatment. And then give it enough time for it to work. Just don't be, oh, I'm frustrated because it's not working right now. Give it a few months And
typically, I recommend to patients with severe injuries, like a herniated disc, a torn rotator cuff, a herniated disc, a torn meniscus, things like that, to give it 3 months of therapy before you make that decision. Because you may be in severe pain for the first month and a half, 2 months, and then the last couple of weeks of the third month, it just completely goes away.
And plus, you're going to be in pain anyway once you have the therapy. So, therapy does not. I mean, the surgery does not make pain go away.
Sometimes it may, but it shouldn't just be the first resort. You shouldn't.
That's what my personal situation was. It didn't make it go away, and I just had to continue to live with it. And then it just started to degenerate and turn into degenerative disc situation, which became complicated with arthritis as year became year after year. I mean, it's just a slow sliding downhill scale, and you can't stop it unless you do the therapy and you get proactive. You got to have somebody that really knows what they're doing, that really has the tools to really help you, and also somebody that you trust. And I found all of that here, and it's unbelievable. It's just right across the street from where I live. So I mean,
we were sitting here for 3 years across the street from each other.
Right. And I said, it's been, not only have I enjoyed coming here and getting therapy, but I've gotten results, and that's where the rubber meets the road. Yeah. And for the results that I give, I just think that is, really, I could almost come here for what my medication costs.
Yeah. And fortunately, you have good insurance.
Right.
Some people don't have insurance,
right,
and they're in the same situation you're in. A lot of those people don't end up getting the surgery first because they can't afford it.
And the thing too is about the prescription drugs. Everybody wants to prescribe prescription drugs, but prescription drugs does not a solution make. I mean, they don't really take pain away. They just mask pain temporarily, and then there can be very severe long-term problems. And so, take it from one who knows. That is not the solution that a back sufferer really should look to for relief.
If you could go back, would you have not taken the prescription pain pills in spite of the benefit it gave you?
If I had this as an option.
Yeah, but you were just felt hopeless.
Yeah, because I didn't know that there was an option. I had gone to chiropractors before, but they didn't give me any relief. As a matter of fact, there seemed to be a conflict between what they would say and what my surgeon would say. Mm-hmm. And of course, you err to the surgeon, or you're going to go with your surgeon. But what you offered me was totally different. It wasn't. It's surgical. It's therapeutic technique, and it's exercise and pointed exercises which focus on my weak areas and make them stronger. And not only is my back getting stronger, my core is getting stronger. And before I would hesitate to walk 50 yards, and now I'm up to maybe, let's say, 100 yards, but I really feel that by the springtime I'll be walking a mile, and that's my goal. I just want to be able to walk a mile, and enjoy it, and I'm hopefully that I can achieve that.
Yeah, well, that's how the program works. We set up attainable goals, and then do what needs to be done to reach those goals, and then see where we fall. We periodically monitor and check and see how we're doing, and as long as we don't push it too fast, or slack off and get too lazy and not do what we need to do, and just be consistent. Number one thing with people getting better is maintaining consistent treatment, to maintain the correct environment in the joints that it needs to heal properly, and get the muscles strong, get the joints flexible, get the range of motion back, and then you will continue to improve as time goes on, and that's what our goal is.
And I just want to say, the last thing I want to say is the thing that I personally appreciate, having worked for IBM so many years, is the fact that your office uses technology and that your medical records are automated. And so not only can you get a clear listing of your history and the things that you've done easily, but they can be shared with other doctors as need be easily.
Yeah.
To me, that's a major benefit. I know that the president has been talking about automating the medical record, but once it's actually done, it's a tremendous benefit to your overall health care program. I'm 59 years old, and medical care and health care is so much more important to me at 59 than when I was 29.
Yeah.
And now these things really start to make a difference.
It doesn't really matter to you until it happens, and you have to deal with it, and not being able to get a report when you need it, not getting the right type of report with the right type of information when you need it. And you need it. You have periodic. We co-manage his case with his neurologist and how many other doctors? I think 3.
3 doctors.
Yeah. So we're able to keep up with all his reports, make sure that they have the reports of what he's doing here, and I have the reports of what you're doing there,
right.
so that we communicate back and forth about what's going on with your condition, your situation, what our goals are, what we're trying to do, what we found, what we're working on, what we're improving on. All that information's there, cut and dry, so nobody's guessing at what's going on or what level it's at or where we're at.
I mean, there's no longer a situation where you have one doctor. Doctors now, you have specialists, and your general practitioner will just, you know, send you to all the specialists that you need. Used to be he would do it all. Now they pass it on to fields of specialty, but then getting the medical record intact becomes very difficult, and unless it's automated. And the way that you use technology, I found one of the most appealing thing about it. Once you get the therapy, and once you get the recovery exercises, then you want to know, what did I do, you know, to myself, and what am I paying, and why do I pay it?
You didn't remember very much the first couple of times I saw you because you're still on the pain medication.
Oh, I was taking so much pain medication just because I had trouble literally moving. I mean, when I came in here, I was almost in tears, as you know. It took me about 4 weeks to start to get to the point where I could actually sleep in my bed, because I couldn't lie horizontal. I had to just sit in a chair to sleep. That's how bad my back was. And I just can't tell you how thankful I am that that this miracle happened right across the street from my house, because, you know, I would travel to to Newport News for this therapy if I had to.
No, I've had patients. I actually had patients come from long distances. I've had patients from Denmark, Finland, Kuwait, all over the Caribbean, South America. I've had patients that just happen to be in the area and find out about me and actually come in from there, and they come back whenever they can and come back and see us. Well, it's a very unique thing we do.
I said, and I plan to, no matter what my recovery ability is, I plan to continue to come at least once a month, just because it restores my range of motion. And I can, for example, when I would drive, I had to turn my entire body to look over my shoulders. Now I can actually look over my shoulder. I haven't done that in 10 years. I mean, that might be a small thing to somebody, but if you're driving a car and you have to turn your body to see that you want to change lanes, you're not looking ahead, you know. And little things like that really make a difference, not only in your overall ability to move, but just like really in your safety.
Even when the pain is no longer there, which I'm expecting to be able to accomplish with you, even when the pain's no longer there, you mentioned something very important, is that you still plan on coming once a month to improve the range of motion. Even after your pain is gone, you still get benefits from being under regular chiropractic care and doing these exercises. You don't wait until it hurts to come back. You proactively address the issues, the reduced range of motions, the tension in the muscles, the pressure in the joints, to get the pressure relieved, so that it doesn't get back to the point to where you feel like you have to take the pain medication. You don't wait for a crisis to happen and then try to clean it up later. You try to prevent the crisis before it happens, and that's where I come in.
And I've met literally dozens of your patients since I've been here, and to a man and woman, they're all improving. I mean, everybody tells me that, oh, how are you doing this week? Because you see these people, they're here for weekly therapy. They're not here for once a month. They're here because they are hurting. And I mean, without doubt, whether it be elderly, young people, men, women, obese people, thin people, it really doesn't matter. Once your back is out, you're looking for relief, and they are finding it here. So that's what encourages me. I'm not the only one.
Yeah. That's good. Well, cool. I appreciate you taking the time.
My pleasure. Thank you for being here, Doc.
Thanks, bro.
All right.